Hey, welcome to COVID-19 update. No, I am not Dr. Krista Burris. I don't even play a doctor on television, and we're just doing a little fill-in here. This is a real show. They're real doctors. They really have patients. They really have a clinic, and so we're just filling in while Dr. Krista Burris is wrapping up a few things. Dr. Kim, welcome.
Thank you, Jeff. Thanks for filling in.
I'm pretty excited that one of you were able to be here today. That's pretty exciting. Hey, when we talk about this whole COVID-19 thing, I can feel it in the air, but I want to keep, the one thing I love about the show every week is it brings us back to reality. And sometimes it's not always, it says sobering sometimes, and sometimes it gets us excited. But I don't know if you feel it, but around the valley, and I was in LA yesterday, around the Southland, it's like people are feeling like, hey, we're almost back to normal. How close to reality is that?
No, I think the numbers are showing that, and I think, it's always one of those. We were there last summer and we went to Red Tier, and then the wheels came off the bus, and we're at a very different point. But today we had a positive rapid, so it's still out there. The chance of someone running into someone who might have COVID is still higher than we'd like it to be. And so, despite the vaccines, which are definitely helping, we're up against the race of the new variant. So there's just a lot of things in the air. It's all good news, but we don't want to do all of this and have all the kids start going back and do all of this just to then get another rebound. So I think if we could just tell everyone to stay hang in there for another month, then I think it's going to be well worth it. But I agree with you. It seems like a lot of things are getting back to normal, and I'm just a little hesitant about that. But
it reminds me, my background is golf and played golf forever. And it would remind me of those days where we'd have a little frost delay and we would have to wait, even though it was bright and sunny outside and we could kind of see it melting. We couldn't get out on the greens for maybe a half an hour after that because us walking on those greens, the grass had not really become unthawed, if you will, and we could actually damage it, and then we would have to suffer with that for a long-term effect. And it feels like how you described that was almost what happened in the summer. We kind of thought we were, we had control of this bus, and we all got out and kind of did things at the beach, and we went out and did things, in person. And then, as my grandma said, all hell broke loose. And so here we are. Do you think we learned from that?
I think we did learn from that, but I don't know. Human behavior is human behavior, and the viruses. There's no immediate, effect. When you damage the green, the green is damaged, and you can see the ball, and you're like, oh, the green is damaged. With this, we don't see the effects for 3-4 weeks down the road. So that's what makes really the hardest part is the delay in what happens as a country as a whole.
Yeah. Another little buzz that seems to be going on, and it's I want to make sure that I don't get on the wrong side of this buzz and perpetuate a bad thing. But, people are saying, hey, the numbers that we see that keep us in this widespread purple zone are really because our testing numbers are down, but yet the people that are getting vaccinated are going up. So why would I go and be tested? If I already have the vaccine, I've already been tested or vaccinated twice, why would I go and be tested? Where are we at on that? And are those numbers going to be figured in your opinion? And are they truly holding us back from going to the next tier?
Well, we've always known that if we don't reach a testing threshold, we get penalized. It's because they don't want anyone to game the system and say, well, we did 0 tests, so there's 0 COVID out, so therefore we should go up. And despite people getting vaccinated, we do need a certain number of tests to prove they're all negative. So if the certain threshold is met and they're all negative, those are good things. And that is harder because not as many people are testing. Everything is kind of going toward vaccination, which it should be. But I do think, we're not quite out of the woods. So, getting the test, is probably something that those numbers will increase, especially because as athletes go back, they're going to have to get tested. So those numbers will add to, the overall testing. And we even tested the Palm Desert high school water polo team. And so they were able to play Xavier High School in water polo. So, I think there's some good things that are occurring. And as long as people, can do it in a common sense way, I think they can continue versus, everyone taking that as a sign of, well, we did it once, we can now, don't need to do any social distancing. And then I think that's where, at least at this point, where we can get in trouble because we're not at a number where you're not likely to run into COVID out there.
So are you really suggesting or encouraging people, like yourself and Dr. Burris who have had both shots? I mean, would you go and get tested again?
You mean through the county?
Yeah.
If the county says we need more testing, I wouldn't mind. I don't mind going to drive the testing numbers up so that we don't get that penalty. We just need to know if COVID, how the true numbers are here. And the only way to know that is by testing, because I was just going to say, because still, despite the number of vaccines that are out there, only a small fraction of our population has been vaccinated. So we do want to, keep that. I hear her. She's coming now.
Yay! She's coming off the hook.
We can. I think. Test less, more or less, as we continue to vaccinate more. But I don't think we vaccinated enough people to really feel like, oh, we're good.
Well, our vaccinated numbers, I mean, I think what is it, around 7 to 11%, something really, like you say, it's a very small number of the people who have had that, the two vaccinations, and maybe 15 or so percent that have had at least one. Are those fairly accurate?
So, yeah, I think
okay.
So. I think Dr. Burris has more numbers, but and then we know that there are certain minority groups that are much less than even that, and so trying to get everyone vaccinated as quickly as possible is going to be one of the key ways of everything continue to open up. So.
Could we almost start a little grassroots campaign here of that message of, even if you have been vaccinated, it's still important to contribute to the test to keep driving us into that next tier to get more, I don't want to say accurate numbers, but the numbers necessary for people to make a decision, that we give them enough data they can say, okay, you guys can move to the next tier, or you can't move to the next tier.
Right. No, I think so. I think that's all everyone's trying to do, is get some good data out there that's representational to what we think is going on, so that people, we can make a smart decision. So, I don't even know which testing sites are up, because at least I know the Indio testing site at the fairgrounds is now just completely vaccination driven. And so I know Eisenhower has a testing site, but I don't know where the other ones. I think Rancho Mirage Library still has one.
I think there's one going on in La Quinta at the Wellness Center.
Okay.
They go from 8 to 4 Monday through Friday. In other words, I've seen that sign because that's kind of in my driving, and I see it. I think they're still doing that as of just a couple of days ago.
Okay. Has Dr. Burris entered her video?
She's here. I was just I was keeping her in the waiting room. I'll bring her in because I want to ask you guys one question together, if you don't mind, and I'll bug out and let you guys take over again.
Absolutely.
There she is, Dr. Burris. I was trying to let her foster grants get a little bit more normal color there. There we go. I wear those that change color as well, and I forget sometimes in my, coming in and out of the sun. We live in a bright, sunny area. So, hi, Dr. Burris.
Good afternoon. Yes.
You could have said morning, evening. It all works. Hey, I want to ask a question. What's that?
Go ahead.
I just want to ask a question, and this may be something you're going to bring up, so I apologize if I'm a spoiler, so it'll be a spoiler alert, but I noticed a couple of days ago the CDC gave out some new information as far as guidelines concerning, hey, if you've been vaccinated, if you've had one shot or two shots going forward. But then to me, as I read the end of that CDC requirement or recommendation, it almost felt like they had this fallback of, hey, let's make sure you keep your mask on, social distance, wash your hands. Can you comment on that?
Yes, I know there was a push for the CDC to say something, but I almost wish they hadn't been so like, okay, go ahead and get together, and you don't have to wear a mask, but then make sure you wear your mask, because it kind of gave out that sort of, confusing lines. But really what they're saying is, once you have everyone in a group completely vaccinated, which means 2 weeks after that second dose or 2 weeks after the first dose of the J&J vaccine, then your likelihood of catching COVID is extremely small, but it's not zero. So there's, in medicine, we're always talking about risk. The percentage of risk, is this low risk? Is this high risk? We're never talking about zero risk. So when you're giving these very vague population level recommendations, it can be a little tricky to thread that needle, because you want to let the average person know what they can do without telling the high-risk person to do something dangerous. So it's a little tricky. So I would say, I feel pretty comfortable being around vaccinated people pretty close together with our masks on. But I still don't take my mask off around people I know are vaccinated. And I probably won't for a long time. And part of it's just habit, but part of it's also knowing the risk isn't zero. And I don't want to take it home to my unvaccinated family. So because I know there's still this risk that I could catch an asymptomatic infection or a really mild case, and there's still so many people that I interact with on a daily basis in my home who haven't been vaccinated, there's no way I want to risk that. So I'm going to keep wearing my mask. If you lived alone and you were getting together with one friend who also lived alone and you've both been vaccinated, I think that would be a different story for me. I think I probably would feel fine going out to lunch at somebody's house in that situation and not wearing a mask. But so there is a little bit of nuance to it. So I'd say if you have any doubts, just keep your mask on. But once more of us are vaccinated, these questions are going to kind of be moot, because, once we've reached that herd immunity, we won't be in this weird transitional stage that we are right now.
Yeah, I agree with Dr. Burris. I almost wish they would have said, this is the overarching principle, right? This is what should happen, but absolutely talk to your doctor, talk to your local public health department if you're wondering what you should do, because it's different everywhere. And those, LA is going to be much different than Anchorage, Alaska, which will be different than Coachella. And so, those nuances can be better addressed by your physician or the local health department, rather than a one size fits all for everyone. Because now everyone's going to say, like Dr. Burris said, that doesn't make sense here. Well, it does on a broad scale, but not.
Yeah, and I know quite a few people who went somewhere just a couple hours after they got their first dose, and they're like, I'm good, I'm vaccinated, and I know quite a few people, actually, just because of the type of jobs we have, who've actually developed COVID after their first shot, but before the second. So they may have been exposed prior to getting that first shot or around the same time, and they just didn't have any immunity yet. And so they actually got diagnosed with COVID a week later.
Wow.
So because of that, you know, I'm excited. It's fun to see all these people getting vaccinated and kind of having that sort of, weight off their shoulders. And I just am hoping that some of the habits will just stick around for a few more weeks. It's like give yourself, 2 weeks after that second shot before you think of yourself as vaccinated.
Well, it's something, it feels like, we've kind of gone almost full circle when this whole thing first started. I can hear you both clearly talking about, your own family bubble and what does that look like. And if you're only communicating with a certain number of people consistently and you know where they're going and what they're doing and who they're seeing, and you feel comfortable being around them, then you're probably okay. It sounds like it's kind of taken on some of that same flavor. And then the second piece is, hey, just because I got a bike doesn't mean I should be in the Tour de France later in the year. I need to give a little bit of time. So those are great pieces. I'm going to jump out of here, you guys, and let you continue with the COVID-19 update. I know we have some slides ready to go and some charts. So Dr. Burris and Dr. Kim, I'll turn it over to you now.
Awesome. Well, let's put the first slide up and just get right into it. I think we have the first slide is our weekly summary for the Coachella Valley. And this one will be for last week from District 4. Or it could be the daily summary. Whatever we put up, I'll talk about. What we've seen actually is that we're continuing to drop our numbers in both the county and specifically in Riverside, in the Coachella Valley. And the thing that I wanted to sort of highlight is that our hospital numbers are continuing to drop. So here's our weekly Coachella Valley report. And you'll see here that in our district, just in the Coachella Valley, we've lost 900 people to COVID. This is a tremendous number. And for each one of these people that's passed away, there's an entire family that's been devastated. So this has really taken a toll on our local community. And it is good to keep that in mind as we kind of walk around with jubilation as we're hopefully getting out of this mess, that some people didn't get through it unscathed. So you'll see our new weekly cases are continuing to drop, and we're under 300 now. And let's go to the bottom. The thing that I find really happy is that our actual test positivity rate is dropped so low. We're at 4.1. And that does also reflect our East Valley numbers, which are really important because that's part of that health quartile that they look at to see whether or not we can move to the next tier. So we're doing a pretty good job at getting our positivity rates down, but where we're falling off is in the number of tests. And I think you guys talked about that before I got here, and you'll see that in some of the charts on the next graph. So this next page is our daily epidemiology summary, and you'll see here 452 new cases. That's actually a little bit up from where we've been. It may be just reporting catching up from the weekend, but it's kind of something we should keep an eye on to make sure that doesn't start trending up again. And then if we go down a bit, you'll see our hospitalizations are continuing to drop, and that's good. And let's see, all the way to the bottom, I want to look at our testing and our positivity rates. So if you see here, our positivity rate for the county is down to 4. This actually would land us in the yellow tier or something. But what has happened is that our testing has also been falling. And so when they do that, they adjust our cases per 100,000 up if we're not doing enough testing. And that meant that we just narrowly missed being in that red tier. It took us from like 7.8 to like 8.3. So that little bit of decrease in testing actually held us up this week from making the red tier qualifications. And if you remember, you have to hit that red tier number and then stay there for 2 weeks in order to move. So because we missed it this week, hopefully we'll do better and move our testing up as our cases continue to drop. So I heard someone say something and I thought it was really accurate. They said, if you want to eat in a restaurant, go get a test. And I thought, that's pretty accurate. And there's a reason for it, because if we're doing adequate numbers of community surveillance, we'll be keeping the cases down as we're starting to open up. If we start to open up and we're not doing enough surveillance testing, we risk having another surge. So I'd like to go to the next slide. This is the Riverside County state numbers, and that's where you see our adjusted number. If you look under the county metric there for Riverside, it's at 7.8 is our cases per 100,000, but then 8.3 is adjusted case rate for the assignment. In other words, that got adjusted upwards because we weren't doing enough tests. So at 7.8, we would have made it because the line is 8. So we almost made it. So we're super close. Go get a test. That's the takeaway from this. Next slide. Our next slide, we're going to look a little bit at vaccination for Riverside County. I just want people to get an idea of where we are. Currently, Riverside County has about 600,000 doses that have been administered, and that's both from county sources as well as federal sources such as the CVS vaccines and some of the other people who may have been vaccinated in other counties because they work elsewhere. But what you'll see here is how are we doing based on age group. So in our population that's 75 and older, we've got about half of them vaccinated. And actually a little better than that in our 65 and older group. But remember, we need much higher levels of vaccination to reach herd immunity, probably in the 70 to 80% of people getting vaccinated. So even in these super high risk groups, we seem to be having some difficulties hitting that benchmark. And if we're having that many problems vaccinating our high risk groups, we're going to really run into problems when we pop down into the low risk groups where people may not feel a personal risk from COVID and may be less motivated to get vaccinated. So I'm sort of surprised by this. I thought we would have done better than this. And this is the kind of thing where as we go forward, they may need to design specific solutions to try to get higher vaccination rates in some of these groups. And then if you go to the right, this is looking at percent of each population of a certain ethnicity that's been vaccinated. So it looks like, oh gosh, Native Hawaiian and Pacific Islander people are getting vaccinated more than anybody else, but that's not what that means. That means out of the people who've been identified as that ethnicity in the county, that percentage of them have been vaccinated. And honestly, I suspect that's because there is a large group of these people who may work in healthcare. And that's my guess about why their percentage as a population is, basically leading the pack. Also, we'll have to keep an eye on this to see if we're having groups that are not being reached well with our vaccine, and try to figure out ways to kind of reach those communities if we find that we're really falling behind somewhere. That's it for the slides. I think, Dr. Kim, I'm not 100% sure of everything you talked about, but we've been talking about, between you and I, sort of this weird transition that we're in right now, where half of us are vaccinated in our family and half aren't. Things are starting to open up. We're probably going to be moving into the red tier in the next month or so, and people are going to be moving around more. And there's this feeling of, oh, it's over. And even for myself, I struggle with that a bit, because I know it's not in my head, and I know emotionally I'm still struggling with a lot of the things that we've been through this year. So I feel like kind of in limbo, like we're in this new phase moving into the future, which is also kind of an unknown. And I feel like a lot of people around me are expressing the same level of kind of, insecurity, or just sort of feeling like out of sorts, like we're in uncharted waters.
Yeah, I think everything about this, from the entering into the pandemic to the middle to the, on the downside, getting out of this, it's all new territory, and I think everyone is tired. But it's like a marathon, right? Where we've run this marathon, we have only 1 mile to go, and it would just be sad for us to crash and burn now when the end is in sight. And it's not that we won't finish this; the pandemic will end. It's how well will it end, or how well it won't end. So, are we going to have more stuff happen to people, or can we minimize that? And so that's kind of, I think, where everyone is, and it is tiring, and everyone wants to get back to the way it is, and the way it was, I guess. And I don't know if it ever will be the way it was. I think there are a lot of good lessons we can learn from this that we hope that is sustained, but only time will tell.
Yeah, I had an interesting experience with one of our children, where we went and sat outside to eat at a restaurant at a time when it wasn't busy. There weren't a lot of people around or anything. And my son was really anxious, and I was a little surprised, because we haven't really talked a lot about how dangerous it is, but certainly just all the things that have happened have sort of been internalized by our children. And he was just very uncomfortable in that situation. So it dawned on me that we're probably going to have a transitional period here for ourselves and for our kids, where we're going to have to sort of gradually get back into some of the activities that used to be normal. And that's okay. It's okay to not be like flip a switch and everything's, fine. It's probably going to take some time for us to feel, comfortable again. And I think it's okay to admit that to our kids and talk about it with them a little bit. And then if they are feeling really uncomfortable, not to push them too fast, but kind of help them gradually sort of restart some of those activities. There are people I know who've basically taken no precautions, and I don't think they're going to really have necessarily that issue. But for a lot of us who have been very cautious and who have changed a lot of the ways we do things, this is going to be a process to kind of get back to a state where things are sort of more normal. And I think it's okay to plan for that to take 6 months or a year, and probably about the same amount of time that it's really going to take us to achieve herd immunity.
No, I do agree. Um, we do need to get on to our next show.
Oh, yes. Okay.
So thank you everyone for showing up. We apologize for not starting the data right away, but I think we talked about a lot of good things, and we will be on next week, and hopefully we'll be headed toward the red zone at that point. So we will see you next week at 3 o'clock. Thank you for joining, and if you can, join our next show.